Today, we're diving into a really serious condition called hepatic encephalopathy. Imagine you get an emergency call like this. What's happening here?
This is a huge red flag for liver failure, and you have to act fast.
What you're seeing is hepatic encephalopathy. The liver just isn't cleaning the blood anymore.
And the main culprit here, a toxin called ammonia.
It's a scary three-step process, and it ends with poison getting to the brain.
All right, so how do you even recognize the danger signs?
First, look for big changes in behavior. Are they confused or super sleepy?
Then you've got physical signs like these flapping tremors. This can lead to a coma.
But the good news is there's a key medicine that can help.
It's a syrup called lactulose. Its whole job is to flush that ammonia right out.
Now this is super important. This is not just for constipation.
Its only goal is to get that ammonia poison away from the brain.
So how do you know if it's actually working? Well, you're looking for this number.
Yep, 3 to 4 loose stools a day. That's the sign the ammonia is being flushed out.
Okay, besides the medicine, there are some other critical things to do.
You got to avoid heavy proteins like meat and dulls. They can make ammonia levels worse.
And please, whatever you do, never give sleeping pills. It's incredibly dangerous. Look, the absolute most important step, get him to an ICU immediately. At the end of the day, seeing these signs and acting fast can literally save a life.
So, the big question is, would you be able to spot these dangerous signs now?